My name is Katie Weber with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I am here to talk to you about using action plans. We all know that it is important to take care of our health. To stay healthy, we make healthy food choices, drink enough water, stay active, keep our bodies clean, get enough sleep, and work on our stress. At least 1 out of 5 children and 2 out of 5 adults also have some type of illness that lasts a long time and needs treatment. We call an illness a chronic disease if it lasts for at least 3 months. Chronic diseases usually last the rest of your life. Many chronic diseases get worse over time, especially if you do not take care of them. It is important to learn how to take care of yourself so you do not get worse. The most common chronic diseases in children are asthma and inattention with hyperactivity. Some common chronic diseases that adults get are diabetes or high blood sugar, hypertension or high blood pressure, high cholesterol, asthma, and heart disease. Persons with IDD also have high rates of seizures and chronic constipation. These are all illnesses that can be controlled, but usually won't go away. To control your chronic disease, you may need to take a medicine every day. You may need to eat special food. You may need to stay away from things that irritate your body. These are all steps you can take in an action plan for your health. Action plans are easy-to-read forms with info that helps you treat a chronic disease over time. They give you steps to feel your best. They also help you know what to do if you get sick. There are 7 basic parts of an action plan. They are separated into the 3 colors of the stoplight. You are in the green zone when you are feeling well. The yellow zone is when you are feeling kind of bad. The red zone is when you are feeling really bad. The following is a video that goes through a talk between a doctor and a patient about action plans.
Melanie, we've been talking a lot about constipation, and I want to show you this stoplight action plan because I think it might help with managing this at home.
Okay.
And I want you to notice that there are 3 colors on this page. There's the green light zone, the yellow light zone, and the red light zone. Tell me what green light means to you.
Good to go.
Good to go, perfect. So that's exactly what green light means, that I'm in a good to go state. And what does yellow light mean?
Slow down, maybe some problems on the way.
Excellent. Slow down, pay attention, be careful. So we're going to talk about if your good to go state changes,
Okay.
how do you know what that feels like and what to do about that?
Okay.
And then what does red light mean?
Stop.
Yep. So stop.
Emergency.
You got to do something different. Exactly. So those are the 3 different zones of an action plan, okay?
Okay.
And in each one, it first tells us, like, what's our goal? And you remember when we were talking about constipation that we said that going soft and easy at least every 2 days was the goal we set for you. Mm-hmm. And there's a number of things you're going to do to help make that happen. You have a medicine you can use, but I want you to remember that it's not just the medicine that fixes this, right? Mm-hmm. So number 1, we talked a little bit about fiber in your diet. Remember, we talked about whole grains and fruits and veggies. Mm-hmm. So how much of those you have is the first thing you're going to work on.
Okay.
The second thing is how you stay hydrated, right? Mm-hmm. And what are you doing to drink enough liquids now?
Using my water bottle to gauge.
Perfect. And keep active because that keeps your colon going. Mm-hmm. And then you have a treatment plan, and I think you picked to use prune juice, right? Mm-hmm. And so you're going to use your prune juice a couple times a week to help this all work. Mm-hmm. Great. Now, what if it's not working? So then if we're in the yellow zone, that means like maybe you skipped some days and didn't go, or the poop's getting bigger or harder, or it hurts when you go. All of those might be times when you say, uh-oh, I'm not in the green zone anymore, I'm in the yellow zone. Okay. And the rules for the yellow zone are do more of anything from the green zone.
Okay.
So you could do more fiber, or more liquids, or be more active, or change how much of your colon medicine, the prune juice, you're taking. Okay? And we wrote a little bit more information about that out here, about how much more you might take.
Okay.
And then in the red zone, this is like you haven't gone to the bathroom for 4 days, 5 days, and your stomach's starting to feel swollen and maybe even starts hurting, and you don't know what to do. So what you do in that zone is you figure out who you're supposed to call. That's me in this circumstance. And then what do you do while you're waiting for an answer? You might still take a double up dose of prune juice, or you have some senna at home. You might take that as well.
Okay.
And then if it's still not working and you start vomiting, or your pain is getting worse, that would be a time to just go to the hospital. And so you might even get somebody to drive you there. If no one was available to drive you there, you'd call 911 to get an ambulance.
Okay.
So that's now green zone, yellow zone, red zone. How does that feel for you?
Sounds pretty good.
And
Feels
I
good.
think you should take this home, right? And where are you going to put this at home to help you?
I'm going to put it on my refrigerator.
I love this idea. Good job.
Talk to your doctor about making an action plan for your own chronic illness. Then practice following the steps. Review the plan with your family or caregivers who help you. Ask for more help from your nurse or doctor if you need it. Keep working at taking better care of yourself. It may take some time to build new healthy habits. We have some examples of action plans for common chronic diseases on our website, forourhealth.org. You can also ask your doctor or nurse about where you can learn even more about your chronic disease. Thank you for watching. I hope this video helps you feel ready to use an action plan to take better care of your health. For more videos and other ideas for being healthy, please visit our website, forourhealth.org.